Hello everyone, am I audible and visible to you? Okay. So myself, Dr. Shital Gataliya, your faculty for physiology. Welcome on the platform of Unacademy. I did MD Physiology from MP Shah Medical College and I'm educating MBBS and MD students. I have teaching experience of more than 17 years and I am one of the experienced faculty for integrated curriculum teaching. NEET PG free test calendar is available for March month or week 4. You can use code Shital10 to unlock free live tests. Previous year question bank are released. Launching MBBS Professor 1, your path towards MBBS, tracking MBBS and next exam. Doubt clarification series is available now. Let us go through some subscription details of Unacademy. With Plus subscription, you can have access to both live as well as recorded classes. You can learn from topmost educators of India. You can compete in live tests and quizzes. You can study on the device of your own choice and you can have access to the question bank having more than 25,000 questions in it. Iconic subscription, you can have access to the best from two of the best. Unacademy and Prep Letter. With Unacademy, you will find various resources like well-structured live batches, recorded classes, question bank, more than 25,000 questions in it, and many more. Unacademy and Prep Letter. With the Prep Letter, you will find clinical and integrated essentials, video lectures from Dream Team, rapid revision and snapshot, and many more. So both are unique in its own way. Whatever is best suitable for you, that you can choose. These all are toppers of FMG December 2021. Congratulations to all the toppers from Unacademy. Now Unacademy came up with some special class feature. Now classes will be highly interactive. There will be also a poll for the learner for their better understanding. You can raise a hand and interact with your educator. You will never miss a class because Unacademy will send you regular notifications. Lecture notes are available. You can download it and you can even have access to the recorded sessions. You can attend the classes from any time, anywhere. There are various revision batches available. NEET PG 2022 high year theory revision batch is there. Duration is 1.5 month. FMG 2022 high year revision and MCQ batch is there. Duration is 2 months. So NEET PG subscription plus iconic and light subscriptions are available with various duration and different prices. As I told you, previous question bank is released and launching auto daily practice papers. Okay, so you can have a quick practice test after every plus class to assess your knowledge about the concept. And launching MBBS Professor 1, your path towards MBBS. Today's topic of respiratory system, that is some applied aspects I'm going to cover today. So let us start with the first topic, that is dyspnea. Understand the word carefully. Dyspnea. This stands for difficulty. Okay, this stands for difficulty. And pnea stands for respiration. Right? So dyspnea means difficulty in breathing. Okay. This stands for difficult. Dysphagia. Okay. So dyspnea means difficulty in respiration. Now, it occurs when the difficulty in breathing, or you can say unconscious subjective awareness of breathing is there. When it occurs, whenever maximum voluntary ventilation is more than normal. Whenever maximum voluntary ventilation is more than normal, when vital capacity of the individual reduces. Okay, and when there is an increase in the pulmonary ventilation. Okay, so three things are there. When maximum voluntary ventilation is less than, It is less than normal when there is vital capacity reduces and when pulmonary ventilation increases. So it causes the dyspnea, or you can say uncomfortable subjective awareness, okay, about breathing. There are various causes of it. Physiological and pathological causes are there which can cause dyspnea in the individual. Physiological causes are severe exercise. When person undergoes heavy exercise or severe exercise, there will be increase in the pulmonary ventilation. So increase in the pulmonary ventilation will cause a dyspnea in the individual. Okay. Then pathological causes. There are list of respiratory conditions which can cause pathologically causes dyspnea. The first one is like bronchial asthma. So what happens in bronchial asthma? Vital capacity decreases, right? So it causes dyspnea in the individual. Then another one is emphysema. In emphysema also vital capacity reduces. So when vital capacity reduces, it causes unpleasant subjective awareness about breathing. Okay. Then in case of metabolic acidosis, so when there is a metabolic acidosis, it will cause increase in the pulmonary ventilation. Increase in the pulmonary ventilation will cause dyspnea in the individual. Then in case of cardiac failure, okay, in case of cardiac failure, that can also cause dyspnea in the individual. That occurs because of the pulmonary congestion. Okay, that occurs because of the pulmonary congestion. So it will cause tachypnea in the individual. So these all are physiological and pathological reasons behind dyspnea. Okay. Then next one, that is asphaxia. Understand the word carefully. Asphaxia. It refers to the condition in which there is hypoxia which is associated with the hypercapnia. Okay, condition in which hypoxia is associated with the hypercapnia. There are two types of asphaxia. One is general asphaxia and local asphaxia. Understand this carefully. General asphaxia and local asphaxia. Okay, now what we mean by this local asphaxia? Here, whenever locally, if you are tying the blood vessel, individual blood vessel, okay, when you tie individual blood vessel, it will cause decrease in the blood flow, to that tissue only, and causes asphaxia. So ligation of blood vessel will cause decrease in the local blood flow, causes local asphaxia. Okay, now let us understand the first one, that is general asphaxia. Understand this, generalized, right? Individual, it is not about the individual part of the body, it is generalized, means throughout the body. This can be acute or it can be chronic. See the word carefully, acute. Acute means sudden onset, right? Acute means sudden onset. Chronic means gradual onset, right? Gradual onset of asphaxia. So acute asphaxia means there is a sudden blockage of airway. Okay, it will cause sudden blockage of the airway. So it can happen in case of drowning, in case of strangulation, in case of acute tracheal obstruction. Okay, in case of drowning, in case of acute tracheal obstruction, in case of strangulation, in case of paralysis of diaphragm. Okay, so all this will cause acute asphyxia, means sudden onset of the asphyxia, means there is a sudden blockage of the airway, which causes decrease hypoxia, decrease in O2 and increase in the CO2 concentration in the individual. Chronic means gradual onset, right? So it occurs in case of patients like core pulmonary. Okay, where there is a gradual slowly asphyxia develops. Okay, so there are two varieties. General asphyxia is having two varieties, acute and chronic asphyxia. Right now there are three stages of asphyxia. There are three stages of asphyxia. See the first one, stage 1 of hyperpnea. See the word hyperpnea, right? Means there is increase in the rate of respiration, right? Hyperpnea. So what will happen? There will be sudden and powerful stimulation of the respiratory center will be there. Okay, that is because see, asphyxia is associated with decrease in O2 and increase in the CO2 concentration, right? So CO2 is a potent, a very strong stimulant of respiratory center, right? So sudden and powerful stimulation of the respiratory center will occur. That is because of increase in the CO2 concentration. So what it will do? It will increase rate and depth. Okay, I said hyperpnea, right? Means here rate of the respiration as well as depth of the respiration will increase, right? Rate as well as depth of respiration will increase. But because of the obstruction of the airway, there will also be dyspnea, right? That is difficulty in breathing. So that is stage 1. Stage 1 of hyperpnea. Increase in the rate and depth of respiration because of because of hypoxia and hypercapnia. Okay, then another one, stage 2, stage of central execution. Okay, see the word. Okay, stage 2, here there is a sudden powerful stimulation of the respiratory center because of increase in the CO2 and fall in O2. Okay, here expiratory efforts are more violent. Okay, expiration becomes more violent. Okay, it is associated with other systemic changes also. Other systemic changes like there will be increase in the heart rate and increase in the systemic blood pressure. Increase in the heart rate and increase in the systemic blood pressure will be there. There will be constriction. There will be pupillary constriction. Okay, constriction of pupils. Then all reflexes of body are exaggerated, right? Then if it sustains, in that case there will be conversion. If asphyxia continues, then there will be conversions, or you can, and it can even cause unconsciousness in the individual. Okay, so other systemic changes will also occur. In case of stage 2, there will be, that is the stage of central excitement. Okay, this is the stage of central excitement. So the expiratory efforts because of hypoxia and hypercapnia. There is hypoxia and hypercapnia, right? So both of this will cause more expiratory efforts becomes more violent. Other systemic changes will also occur like increase in heart rate, increase in blood pressure, pupillary constriction, all the body reflexes are exaggerated, and conversion and unconsciousness of the individual, right? So that is stage 2 of asphyxia. Then third one, that is a stage of central depression. If asphyxia continues, then the stage 3, that is a stage of central depression. Here what will happen? There will be direct effect of lack of oxygen on the vital centers. Okay, and it causes inhibition of these centers. Okay, direct effect of oxygen lack. Okay, direct effect of hypoxia, you can say. Okay, on the centers, okay, on the vital centers of the brain and body, and it causes their inhibition. Okay, so here this is a stage of depression, stage of central depression, right? So what it will cause? Gradually conversion will disappear. Okay, respiration becomes slow, and then the person will go in gasping. Okay, there will be decrease in the heart rate, fall in blood pressure, then pupil will get dilated. Okay, pupillary dilatation will occur. Okay, all reflexes of the body, they are abolished. Okay, and whole body lies like a steel. Okay, whole body lies steel, and even death of the individual may occur, right? So that is a stage of central depression. Okay, so there are three stages, right? First one is a stage of hyperpnea, second one stage of central excitement, and third one is a stage of central depression. Okay, so these are stages of asphaxia. Now come to the next part. Okay, next applied aspect, that is drowning. Okay, see, in 90% of the cases of drowning, usually what happens is glottis relaxes. Okay, because of the relaxation of the glottis, water will enter in the lungs. Okay, water enters in the lungs. If depend on the type of the water, okay, in which the person is drowned. If the fresh water enters, that is hypotonic. See the word carefully, hypotonic. So if hypotonic fluid is there, it will enter into the circulation. This one will enter into the circulation, and it will cause intravascular hemolysis, right? Because it enters into the circulation. If it is a sea water, then sea water is hypertonic, right? So if it is hypertonic, okay, in that case it will drain the water, or you can say fluid, it will drain the fluid from circulation, right, into the lungs. And so because it is draining the fluid from the circulation, it will cause decrease in the blood volume. Okay, and fluid enters into the lungs. Okay, so this will cause various respiratory symptoms. Okay, then in case of 10% of the cases, what happen? There will be first gasps of water. Okay, there are first gasp of water. Okay, that will cause laryngospasm. That will cause laryngospasm in the individual. Okay, spasm of the larynx will be there. So it will cause asphaxia. Okay, it will cause asphaxia in the individual. So 90% of the cases, what will happen? Glottis will relax and water will enter into the lungs. Okay, once water enters into the lung, now it is totally dependent on the type of the water. If the water is hypotonic, okay, then it enters into the circulation. It is hypotonic, right? So it will cause intravascular hemolysis because it will enter in the red blood cells, and it will cause a swelling of the RBCs. When it causes swelling of the RBC, eventually RBC will get lynched, right? So when hypotonic fresh water is there, it is hypotonic in nature and it causes intravascular hemolysis. If it is the sea water, then it is hypertonic, right? So what it will do is it will cause movement of the fluid from the circulation into the lungs, right? So it causes congestion in the lungs, right? And because the fluid moves from the circulation in the lungs, so it will cause decrease in the blood volume. Blood volume will be reduced. Then that is about when if water enters into the respiratory tract. If in 10% of the cases, what will happen? With first gasp of water, there will be laryngospasm. Okay, so because of the spasm of the laryngospasm, so it will cause asphaxia in the individual. Okay, so this is about the drowning. Okay, now the next one. This is very, very important. Periodic breathing. Understand the word carefully. Periodic breathing. Okay, means breathing which occurs in various phases, you can say, right? Two important types of periodic breathing are Kind stop breathing and Biot's breathing. Let us understand the first one. Okay, see, in periodic breathing, what happened is that there is a sequence. Okay, there is a sequence of breathing and apnea. Okay, apnea, which is followed by respiration. Okay, apnea means absence of respiration followed by respiration. Let us go through the first one, that is Kinstop breathing. Okay, see here what will happen. In Kinstop breathing, there is a gradual onset. There is a gradual onset of apnea. Gradual onset of apnea followed by gradual onset. Okay, this is also gradual onset of respiration. Okay, so what happens here is, this is apnea, there is a gradual onset of respiration. Okay, it reaches to the peak, again gradually it goes down, rate goes down. Okay, again there will be a period of apnea. Okay, this is very important image based question. Okay, again it will start increasing, again it will reduce, and there will be a phase of apnea. So see this period of apnea followed by respiration. Apnea followed by respiration. So what happened here is, during the phase of apnea, okay, there will be accumulation of CO2. So when CO2 is accumulated, it will cause stimulation. CO2 accumulation will cause respiratory center stimulation. Okay, accumulation of the CO2 will cause respiratory center stimulation. So there will be gradual onset. There will be gradual onset of breathing, right? Or you can say respiration, right? Then it will start increasing. See this pattern? It will increase. Okay. Once it increases, what it causes is, with each act of respiration, it causes wash out. Okay. It will wash out CO2. So when it will wash out CO2, there is no longer respiratory center stimulation. So gradual onset of respiration will cause CO2 wash out. Okay. So again there will be apnea. Okay. So no respiration, right? So again there will be CO2 accumulation. Okay. Which will again cause respiratory center stimulation. Okay. Respiratory center stimulation. So again it will cause onset of respiration. So this way this cycle keeps on happening. Okay, so this type of breathing is called as a Kinstop breathing. Now there are various causes, physiological and pathological causes. Okay, physiological causes and pathological causes of such type of periodic breathing. Kinstop breathing is, if there is a voluntary, if person undergoes this, you might have experienced also voluntary hyperventilation. Okay, so in that case it can cause Kinstop breathing. Okay, then in case if the person is at high altitude, okay, in case during sleep. Okay, so these are the physiological causes. Okay, what about pathological causes? In case of heart failure. Okay, in case of heart failure, in case of brain damage, okay, in case of uremia, okay, pathological causes of Kinstop breathing. Okay, so that is one type of periodic breathing. Now come to the next one, that is Biot's breathing. Understand the word carefully here. This is also one type of periodic breathing, but here the patterns are highly irregular. Okay, highly irregular means it is like onset of respiration is there, followed by apnea, hyperventilation is there, then slow respiration, apnea. So you can say here there is no fixed pattern of periodic breathing. Okay, इसमें कोई fixed pattern नहीं है. Okay, irregular pattern of respiration will be there. Okay, different causes of it are meningitis. In case of meningitis, in case of disease affecting medulla. Okay, so that can cause Biot's breathing. Now next one, that is apnea. Understand the word carefully. Apnea means absence of respiration, right? So it is defined as complete, okay, it is defined as inhibition or stoppage of respiration. Different causes of apnea are, it can be deglutition apnea. Okay, so in deglutition apnea what will happen, that whenever you are swallowing the food, okay, जब आप when you chew the food and when you are swallowing it, momentary there is a stoppage of respiration. That is this is, you can say it is protective, right? Because deglutition apnea will prevent the entry of the food into the respiratory passage. वो food को respiratory passage में नहीं आने देता, right? So one cause of apnea is deglutition apnea. This is momentary, right? Then after hyperventilation, even you can say voluntarily, अगर आप voluntarily भी hyperventilate करते हैं, okay, in that case this hyperventilation will be followed by a small phase of apnea, but these all are momentary, or you can say for a small period of time there is apnea, right? Then herring brewer deflation reflex, ये हम लोग पढ़ चुके हैं, right, कल. So then Bezold Jerris reflex, okay. In case of sleep apnea, this is very, very important. Sleep apnea syndrome. Okay. So sleep apnea, see the word itself says sleep apnea means apnea is occurring during sleep. Okay. So here you can say there is a respiratory failure. Okay. There is a respiratory failure that is due to depression. This is because of the depression of central chemoreceptors, right? So here what will happen, there will be failure of genioglossus muscles to contract. Failure of which muscle? Genioglossus. Okay, failure of genioglossus muscles to contract, okay, which causes tongue fall. Okay, वो tongue fall करता है. And when there is a tongue fall, अगर tongue fall होता है तो what it will cause? It will cause obstruction. Okay, it will cause obstruction of airway. Airway का obstruction करेगा. Okay, so when there is a obstruction of the airway, it will bring the phase of apnea. ये एक phase apnea का एक phase जो है वो लाएगा, right? Because it occurs during sleep. ये sleep में होता है, right? So it is called as sleep apnea syndrome. अगर sleep apnea है तो how you will come to know what are the common features related to it? Common features are snoring. Okay, this is a common feature. Headache, because of the phases, apnea के छोटे छोटे phases आते रहते हैं during sleep, right? So there will be headache. Okay, unable to concentrate next day. Okay, then in case fatigue. Okay, so these are the common symptoms associated. Because of the sleep apnea, person couldn't have the good sleep. Okay, so headache, inability to concentrate, fatigue, these are common symptoms. Snoring, okay, of sleep apnea. In case of severe and prolonged cases, अगर sleep apnea है और उसको treat नहीं किया जाए, in that case what will happen? Person will eventually, there will be a tendency to develop hypertension. Okay, hypertension की possibility रहती है. Then hypoxic, hypoxic damage, okay, because of constant exposure to low oxygen tension and increase in the CO2 concentration, okay. There is also a polycythemia, okay, polycythemia. Polycythemia का मतलब है there is increase in the RBC count, increase in the total RBC count more than 7 millions per cubic m. Okay, so these are the features. क्योंकि chronic overall during the entire sleep there are phases of apnea and which causes hypoxia and hypercapnia in the individual. It will also causes stimulation of the bone marrow. Okay, hypoxic stimulation will be there. Because of the hypoxic stimulation, it will cause increase in the total RBC count. Okay, it causes polycythemia in the individual. Again, increase in the total RBC count also it also indirectly make person prone to develop hypertension. So that is this is about the if it happens in case of a prolonged phase. अगर sleep apnea जो है वो persistent रहता है, अगर वो severe और longer हो, okay, prolonged, untreated for a long time, in that case it will cause hypertension in the individual, polycythemia and hypertension in the individual. So this is about the applied aspects related to रेस्पिरेटरी सिस्टम. आज के टॉपिक में से जो इम्पोर्टेंट एमसीक्यू पॉइंट ऑफ व्यू से जो चीजें इम्पोर्टेंट है, okay, so causes of this dyspnea, you know, always remember asphaxia can be general or local. General asphaxia can be again acute and chronic in onset. Then there are three stages. One is a stage of hyperpnea, another one is a stage of central excitement, and there is a stage of central depression. Okay, drowning 90% of the individual when water enters into the lungs. Okay, if fresh water is there, in that case hypotonic water will causes intravascular hemolysis. If water is hypertonic, then it will cause decrease in the blood volume because fluid will move from the circulation into the lungs. Okay, in 10% of the individual, asphaxia will occur because of the laryngospasm. That occurs because of the first gasp of water will cause laryngospasm, which causes asphaxia. Then this is important. Kind stop respiration and Biot's breathing. Okay, see this image, you should remember this image. Okay, remember the entire cycle. Okay, there is a phase of apnea followed by hyperventilation. Okay, again there is apnea, again gradual onset of respiration. So that cycle keeps on happening. Okay, then Biot's breathing is completely irregular pattern of breathing is this. Okay, here there is no fixed pattern, you can say. Then apnea is inhibition. Okay, deglutition apnea, okay, that is the protective mechanism, you can say, right? Momentarily, because of the apnea, during the process of swallowing, it prevents the food entry into the respiratory passage. Then sleep apnea is because of the depression of the central chemoreceptors, right? The reason behind that is genioglossus muscles जो है वो contract नहीं होंगे, so there will be tongue fall जो है वो respiratory tract का obstruction करता है. Okay, so it will cause hypoxia and hypercapnia in the individual. Okay, so it cause there will be a tendency to develop polycythemia and hypertension if it is for the since longer time. Okay, so this is all about today's class. If you have any question, you can ask. Okay, so thank you so much, all of you. Stay tuned for the study. Subscribe Unacademy Future Doctors channel. Okay, and help us to reach to more and more number of students. Subscribe Unacademy Future Doctors channel and hit the bell icon, so you will be able to receive notifications for the classes.